Hey, Pussy like my new haircut. So, reason I'm wearing this is that I've been taught one time that if you want people to remember stuff, make something special and they will remember. So I thought me and Blondie, that probably will hit a chord. So what are we talking today? We're talking about wound. And why am I wearing this? Is because I always say to a lot of people that wound is like the Goldilocks. You want your wound not too wet, not too dry. You want it right in the middle. And we'll talk a little bit more about that concept in the next, the second part. So this will be a 3-part, and I'm trying to keep it to 3-part. And so the second part, we'll talk more about the dressing and everything. And some of those dressing, you'll see, this is the purpose, is that we'll dress as a layer, just as when we go outside in the outdoors, how we dress and everything. So with the different layers, the different dressing will have different versions. So it was for that concept of not too wet, not too dry, just in the middle. Just like in Goldilocks. Doesn't want her thing too hot, doesn't want her thing too cold. She wants it right in the middle. She doesn't want it too big, bad. Well, it's the same thing for the dressings. So today we're going to talk about a little bit, and I did some videos about this and stuff, and this needs to go out. But remember that. Not too wet, not too dry. And we'll talk a little bit more about it in the second part of the video. So we're going to talk a little bit more about my philosophy on dressings. And I did some videos, and I'll let some of my videos talk about it, but because if I repeat everything stuff, it will be too long. But I wanted to kind of do a composite of where and have a starting point for explaining why I'm going to the dressing that I'm choosing. So first of all, and I call them my 21st century dressings. So first of all, we'll address a few things that I hear, and I have a list over here of things that I kind of see on the on YouTube. I kind of disagree with, and I want to explain so that you can understand why I'm choosing what I'm choosing. So let's start with the big one, suture. And I think I did a video before suture or not suture. And the reason that I don't like suturing is that, first of all, it's a skill that you need to practice. So that means that you cannot just put that in your backpack and that's it and forget about it. You need to practice the skill. So it's a hard skill but it's not a hard skill to practice, but you need to practice it. So that means it gets more involvement to do it. Second, you require more gear. So that means that you need to carry more stuff, which means it's weighted stuff that you probably don't need. Third, all wounds can be closed by secondary closure, which we dressing versus primary closure, which is suture. So secondary closure, you can close every wound. And suture, you cannot close every wound. There's some wounds that suture not recommended, and there's a lot of complication if you close the wrong wounds. So now we have something that requires a lot of skills, requires a lot of equipment, versus the other one you can literally leave in your backpack. You can remember about it, and then when you have the wound, as long as you remember the concept, not too wet, not too dry, just in the middle, then you can apply the dressing. You just remember which dressing to use, you put your dressing, boom, and your dressing is done. So it seems to me that it's much better to use that than suture. But a lot of people, I don't know, there's a charming with it about it. And one of the reasons that is suture, and suture is not better than dressings. Like over here, I did close myself. Oh, sorry, I got dry skin, but over here, there, as you can see, it's hard to find even for me. But over here, I had a scar that is basically closed by secondary closure, so I never use any stuff. And over here, that one that is a little bit more nasty, right there, that one was closed by suture. So the only reason is, that sometimes suture is better is for the aesthetic, and then it depends on how you're going to do it. So no suture for this dude. Products. So that's another big one. A lot of people wants to put stuff in that wounds. I don't know why, but they just want to flush the hell out of this thing and kill every bacteria that ever created life. First of all, the only way that you truly would kill everything and stuff is that if you would put it in the fire. But I don't think it would be very recommended to burn your wounds for that. But one thing that the products do, though, it irritates your wound. And what it creates is that it creates an inflammation process, which can limit the healing of the wounds. And you need to understand something is that when you go, for example, for a surgery or procedure, like, when before you start, if you ever went for a blood test or something, they clean your skin with alcohol and stuff. It's intact skin. And the reason that we do that is that we kill the bacteria before we inject, we put the needle, so that we decrease the insertion of bacteria into the skin. But when you do a wound, so that you cut yourself, you rip yourself, you did a road rash, whatever, the bacteria that you had on your skin went into your wound. They're in there. Like, you cannot clean them. They're already in there. And putting the products has more toxicity about it. And we're not talking about chronic wound, because sometime you need to use that and stuff. And this is outside the goal of this video. We're talking about acute wound here. Is that all you need to do is irrigate. And it makes it easier too, because it means less product to buy, less product to carry, less things to worry about. And all you need to do is a good old syringe or device to push some water, and it doesn't need to be sterile, it doesn't need to be saline. As long as you can drink it, you can wash your wound. And that's it. If you can drink it, you can clean your wound with it. That's the simple root of this. So that makes it easier to clean that, and you don't need to put tons of products, everything, and decrease the inflammatory process of it. And through history, cleaning wounds with irrigation has been proven way back when. Gauze. Gauze is another one. Everybody use gauze and everything, and we'll see in my second series I don't use gauze, and I recommend other stuff. And the reason for, and it comes to another point I want to make, it is more expensive. The dressing I'm going to talk about, they're not cheap. I mean, I was doing a quick calculation for a like a single little kit would cost maybe about $100, and maybe if you want to have about 2 months supplies of it would be about $300. But the thing with that is that the dressing now that you have, you're sure of it. You're sure that those dressing will be there. And this is the same concept of buying a jacket, for example, the Columbia or Patagonia or whatever, or North Face, versus buying a jacket at Walmart when you go outdoors. Jacket at Walmart, yeah, can maybe do the job, but if it gets too rainy or too windy or something, you may get cold, and you can put your life in danger. Well, we're talking about self-reliance situation where basically you'll be on your own with no other services and everything. Well, most of the first aid kit, and even the kits that are sold right now as self-reliance kit or disaster kit or whatever, a lot of them are not meant for prolonged stuff. They're used a lot of gauze, and the reason they use gauze is because gauze is cheaper. And the problem with gauze is that you need a lot of it, and also it doesn't mean that it will heal your wound. Versus another dressing that can cost $25, $30. The dressing, yes, $25 a dressing, but it's going to stay on your wound for 3 weeks, and your wound will be healed nicely, and everything will be nice. And we'll talk a little bit more about that in the second video. But why would I don't invest in this to make sure 100% or 98% of the chance that I'll have a perfect healed thing versus another thing that can can create inflammation. And again, the inflammation process that we were talking about, the gauze may create inflammation process. And I was reading a book on nursing from 1934, and they were already saying gauze is not good. 1934. And we're still using gauze here. And the only reason is that it's cheaper. It's easier to carry. But the problem is you need to carry a little bit more and stuff. You see this little piece of it here. I can reuse this. I can clean it. But look at the size of that thing. It's nothing. And so that means that my kit can go smaller, more efficient, but obviously, just like anything, it costs a little bit more. But sometimes costing a little bit more means that it will be more efficient. Then you can rely on it. And then when the brown stuff hit the fan, you will be able to say, yes, I do have the proper dressings and everything and stuff. So we'll talk a little bit more about that. Sterile versus clean. So a lot of people talk about, oh, keep your sterile dressing stuff. Why would I need to clean to keep something sterile when my wound is not sterile? My wound is dirty. So I take something sterile and I put it on the dirty dressing. On the dirty wound, what do you think is going to happen? My dressing will get dirty. And I'm not talking about blowing my nose in the dressing and then putting it, or sweating in my dressing and then or sweating in my shirt and then putting it on it. But we're talking about clean versus sterile. Your dressings don't need to be sterile. They need to be clean for the outside. I'm not talking about hospital. The hospital is a different game and stuff like this, and even now we could have a discussion about that, but you all need to be clean. So as long as you have clean stuff that can go on your wounds, that's perfectly fine. It doesn't need to be sterile. And so what it happens a lot of the time, as you can see, this one is a demo I'm sending it to a friend and stuff, but a lot of the dressing could be carried easier if you take them off their kit and then you make them in the bags and stuff like this, like a sealing bag and things. They're easier to carry than in their big envelopes and stuff like this and stuff. So, and I made a video about that, a video response. So sterile versus clean, don't need that. Supply versus creation. So one of the other issue I see is a lot of people try to sell big kits. Oh yes, buy 300 gauze and you'll be good for 1 year and stuff. There's one problem with this. First of all, and I'm kind of thinking about creating like a chart of like how many wounds a kit can do, so you can assess different kits according to the wounds it can take care of. So I'm talking about that now. But the problem with your supplies is that when you're talking about the 2 months grader, first, you don't know when it's going to stop. So how can you know how much stuff you need if you don't know how long it's going to last? So, and second of all, you don't know how many wounds you're going to have in a period. So you could have 5 wounds in the first 3 weeks, no wounds for the next 3 months, and then 10 more wounds in the last 10 months. So how does your supplies work? You don't know. So I am a big believer in making your own stuff. And so to kind of create and to improvise some of the dressing. For those reasons that because there's so many unknown, that if you can create stuff, that means that you can reuse things and stuff. Then if you go that way, that means you can create your own dressing. And that means you can reuse them and stuff. The second thing too is that, just for example, like Katrina, when it flooded pretty much like 3/4 of the house, I can lose all my supplies, so now I can reproduce my supplies. And so we're going to talk about that in the third part. But the supplies versus the creation, I think it's really important that we, in our preparation, that we prepare a way of creating dressing, to improvise dressing, to see how can I still apply the concept of the wet and dry and right in the middle with some of the dressings or some of the stuff that we have without no supplies. So, and then the last one I wanted to talk about was the creams. Polysporin, triple antibiotic ointment, big thing on the internet. Everybody puts it on it. They're not that great, and I don't like them. Yes, triple ointment, could see some if you have like sign of infection, but otherwise they're a little bit useless, and actually using too much of it can create some problem, and we'll talk a little bit more about that in the second part. But there's other stuff that you can use more than those creams, and don't put it all the time, because again you define that rule of too wet, too dry, because you're putting so much cream and everything, and basically you're creating and stuff. Anyway, so that was the first part. We'll do a second part pretty soon, and we'll talk to you soon.